Good afternoon, thank you for being filmed today. We're here in sunny and a lovely view behind us in St Austell at our Integrated Care Board for October. Could you tell us your name and your job title and your role on the board, please?
My name is Dr. Smitish Patel. I'm the primary care member, statutory board member for Cornwall and the Isles of Scilly ICB.
And just tell us a little bit about your day job as well, please.
So I'm a GP as well. So I'm a GP that works out in East Cornwall in Liscard. So I do that a couple of days a week, doing all the things, all the normal things that a GP would do. I'm also a clinical director for a primary care network out in East Cornwall as well. So looking after 7 different practices, covering around 72,000 patients, and trying to mould services for those patients and improve the health of the population.
Thank you. And you brought a paper to board today which is about primary care, covers quite extensively. When we talk about primary care, we cover quite a lot of different areas within that, don't we? So that includes GP surgeries and the services that a GP practice will provide, and also things like pharmacy and dentistry as well. Can you tell us a little bit about what your paper talked about? In particular, I was quite impressed with the Claire Fuller visit.
So that's right, yeah. My job is to represent all of primary care, so all of those areas you mentioned, dentistry, optometry, community pharmacy, and of course general practice. Today I talked mostly about updates within primary care, but in particular, we had a visit from Dr. Claire Fuller last month, who came down to look at what we do here in Cornwall and also give us an idea of what the priorities for NHS England are this year or in the coming years, given a new government and a new change for primary care. So in particular, we talked a lot about things like GP retention, patient safety, but more so talking about an improvement between primary and secondary care. And for those of you that might not get that, primary care is all the kind of services that we've described above, so the dentistry, optometry, etc. In the middle, you kind of have community services, which might include voluntary sector services and other services provided within the community. And secondary care is what people would traditionally think about as their acute hospital trusts or going to the hospital. So one of the things that is being talked about a lot recently, particularly with the advent of things like the Darcy report, are what are we doing to make the system better? And one of those things that we could do is to start looking at shifting how we do work and how resources are placed within the NHS. And some of that work revolves around improving relationships and what people like to call interoperability between primary and secondary care. So we had a lot of talk about how that might work and how that might look, and looking at where things could be placed in the community, what kind of things we could do like neighbourhood centres, community diagnostic centres, and also how we could address some of the other things within the Darcy report, like re-empowering staff and patients within the NHS and throughout the country in terms of looking after their own health and prioritising health to help the system as a whole.
And can you tell us a little bit about why Claire Fuller is so important for us and why she visited us? Because she's wrote quite an important report about primary care.
So she wrote the Fuller Stocktake several years ago now, sort of in the throes of COVID, talking to the nation and talking to the NHS about how we could improve models of care to try and make the system better and to try and serve the population from a health perspective in a better way. So she is well respected and well looked up to from the NHS community, and you may have heard of her, sort of outside of the NHS community as well. But there's a lot of thinking around how we could make things better. The Fuller Stocktake report outlined 4 pillars for us to kind of focus on as an NHS to be able to do that, and give us really as a system a foundation point where we can start making things better. And particularly in light of things like the COVID pandemic, trying to make a recovery out of that pandemic, but also trying to build on the system we have to make an NHS that's even better, but also serves the population as it is now, because it's changed considerably since it was first started all those years ago.
And Claire Fuller was able to see firsthand what was on offer in Cornwall. I know she had a visit and a good sort of chat with lots of different people, and I joined for some of that event, and she was quite impressed by the innovation and the way people are working in Cornwall. And I think a lot of people forget about, actually, we've got some really good high satisfaction rates for people using our GP practices when we compare that with nationally. And also, when I look back at some of the figures, 4 million general practice appointments last year, almost half of those were face-to-face. And it's really important that we start to encourage people to think differently about the narrative of primary care, because when I think back to pre-pandemic, I remember how challenging it was to access primary care, and I've certainly seen it personally getting better. We know that's not the picture for everyone, but it's certainly an important service. It's a front door to our healthcare service, isn't it?
So I think you're absolutely right. Access to primary care has definitely improved since the pandemic, and I think it's done so without a huge amount of change in terms of resource or funding. So I think that's something that Claire definitely picked up on when she was here. I think one of the other things that she was very impressed with is the kind of collaborative spirit that we have within general practice and within the community here in Cornwall, and I think that's a really important foundation to be able to improve the system upon. There are some significant areas for improvement across the country, but I think Claire was very impressed by what we do here, the community spirit we have here, and some of the different innovations we have here. And you're absolutely right, she visited several different sites where we're looking at slightly different ways of working that work for our communities. So I think that was the key thing. We're very much here in Cornwall doing things that work for our communities, because not one size fits all, and sometimes you have to adapt your system to make sure that the people within it are getting the services that they need.
And today is an important day for mental health, a National Mental Health Day. And obviously we talk a lot about physical health, but mental health is just as important. And what are you seeing in your day-to-day job and the work you're doing around the support for mental health for our local people?
So I think, to answer your question, we have a lot more mental health advocates, we have a lot more mental health champions. In my practice we have mental health first aiders, which are throughout the entire gamut of primary care now. We also have a lot more initiatives throughout, community initiatives throughout Cornwall, including in the fishermen's community, particularly in older men. There are lots of now groups that have been set up around sort of barbershops or social communities that address mental health itself, but also give people the opportunity to access mental health support when they need. And that might not mean, the traditional going to see a therapist or going to see a counsellor, but giving people the opportunity and the space to actually be able to talk about their problems, which sometimes is enough, and sometimes is also just a starting point for people to be able to get on that road to recovery from mental health issues. As you quite rightly said, it's an important milestone in terms of national/world mental health today, and it's really great to hear about the event that's happening over in Weybridge today, where we've had lots of people from the mental health service community and also lots of people from the community join and see what we have to offer here in Cornwall.
And that's a great event. It's good that you brought that up, because I think we've got talking therapists, people can self-refer as well as go through their own primary care referral system as well. But I think as well there's lots of community mental health support, and that might be local walking groups, it might be mums and toddler groups. Looking after your mental health comes in many different ways, and I would definitely encourage viewers watching today's film to go and have a look at what support there is. Even if you just Google mental health Cornwall, you'll see a real range of different advice available for you.
Yeah, absolutely. And I think the key message is, to use the old adage, a problem shared is a problem halved, and it's just about taking that step and knowing that there are people out there, and knowing where those resources are enables people to just start that journey when they need to.
And I think, society looks differently at mental health now. People are more talking about it. That makes it easier to talk about how people are feeling. And it really is okay to not be okay. And, people do have down days and up days, and there is help and support available. And just like you say, talking about it to one another is a really good, bold move forward. As well as today being an important day for mental health, the month of October has got lots of different themes around health, so big stop smoking campaigns that are going on, Black History Month. So we really are trying to support people's sort of well-being in a real sort of open way, like a big warm hug really is what I'd like to describe it. But your point about secondary care connecting with primary care is important, and we're really lucky in Cornwall that we have a good selection of things that can happen locally in our communities. And today, Steve Williams talked about the opening of a new elective surgical hubs over in St Austell, and that's preparing to do 5,000 day surgeries over its first year. There's also community diagnostics offering a range of different scans from CT to MRI, and that's really amazing because it's making services more locally available. And a big focus on today's meeting and lots of discussion and lots of really good points was about something called our new commissioning intentions. And just to explain that a little bit more, the Integrated Care Board provides sort of planning and spend of budget for health across the Cornwall and the Isles of Scilly. And what these intentions are is to set out our plan for this first year, 25-26, and what we're going to be focusing on. And it was really good to hear from people talking about that. I'll just talk briefly about it covering quite a wide ranging from urgent and emergency care, planned care, so that's things like surgical procedures that might be needed, right through to primary care, mental health and children and young people. What are your views on what was discussed today about the commissioning intentions?
So it's a very broad church, as you quite rightly said, commissioning intentions is covering all of those health services, and it's really difficult to necessarily pick out the details and hammer everything out, straight away. But I think what was presented today at board is an excellent foundational starting point, and I think everybody in the room would agree that it's a good starting place for those commissioning intentions. You mentioned that we're looking at sort of the next financial year. I'd like to think that this is a starting point to look at the next 5 years. I think for things like this to be successful, we need to be planning a lot more ahead. One of the things we talk about in healthcare is what we term reactive and proactive care. And reactive care might be thinking about people that are ill right now, and if I was to relate that to our commissioning intentions, we'd say, what are we going to do in the next 6 months or the next year? Whereas proactive care is thinking about the longer term. How can we stop people from becoming ill? How can we stop them from becoming more unwell? And I think in terms of those commissioning intentions, proactive care would be thinking about what can we do over the next 4 or 5 years to put a system in place that's going to last us the next 50 and work really, really well. So some really good ideas around the table today, and a great starting point. It just needs a bit of fleshing out to figure out, practicalities around how we can make it a long-term, sustainable and successful plan.
And I think that's really important to think about that long-term planning, because change doesn't happen overnight. You mentioned Lord Darcy's review into the NHS, where he sort of says fundamentally a big review and reform is needed for NHS care, and that's what we're starting to do here. And I think importantly, it's about picking up some of those themes about how do we move from acute or hospital care into care in our communities. And we know that many people are seeing and wanting to be treated in a different way. The other sort of theme you picked up on is about prevention. What can people do to look after their own health? How can we help people with a long-term condition not get any iller? And perhaps reverse it in the case of diabetes. And then as well, analogue to digital. It's all about being on trend and getting everything online, and that isn't always right for everyone. So there is a nod in those plans about how do we support people who perhaps may not have ease of access to internet and digital services as others. And so I think it's quite a wide ranging, and I'd encourage people to go and have a look at those in our board papers, and we'll be bringing those back again in November and December with the aim to finalise those for implementation ahead of the new financial year. Just thinking about your role as a GP, what do you do to look after your own health and well-being?
That's a very good question. So I guess I would split that into physical and mental health, but often one looks after the other. But personally, I try to walk between 5 and 8 kilometres every day. I try and cycle about 30 or 40 miles a week, and I like to go out and play sports with the kids. Both of my children play rugby and go rowing, so I will sometimes take part. I also coach one of their rugby teams, so that tends to keep me quite fit. And just try and spend a lot of family days out. I don't do any formal gym work. It doesn't have to be that. I think you just have to get up and take a few steps. And one of the things that I personally have committed to do over this winter is to say, whatever the weather, get yourself out for 20 minutes, half an hour, and that works for me, and that's all I need. And that in turn helps me clear my mind and keep my mental health focused as well.
Wow, that does sound very impressive. For me, I'm just starting with 10 minutes a day at the moment to get myself out and about during lunch times or when I'm walking with work colleagues rather than having a meeting, let's go out. And I think that's what it's about, isn't it? Looking after our own health can start in small ways, but those potentially can lead to a really sort of long change and improvement to our long-term health.
That's right. Yeah.
Lovely. Thank you very much for your time today.
Thank you.
Thank you.